Did you know that antidepressants can have unexpected side effects? While antidepressants can be an effective treatment option for those with depression, it is important to understand the side effects of taking antidepressants. The audience should be interested because depression is a common mental health condition that affects millions of people worldwide. Antidepressants are a common treatment option, but they do have risks. Understanding the potential side effects of antidepressants can help people stay informed about their mental health treatment. The first main point is, what are antidepressants? The second main point is the most prescribed type of antidepressant. Lastly, the third main point is whether people should take antidepressants for long-term and possible side effects. So what are antidepressants? The article is newsmedical.net. Antidepressants are a type of medication to use to treat depression and other mental illnesses. There are 4 different types of medications, such as selective serotonin reuptake inhibitors, tricycline antidepressants, atypical depressants, and monoamine oxidase inhibitors. SSRIs work by increasing the levels of serotonin in the brain. Tricycline antidepressants work by changing the levels of certain chemicals in the brain, including serotonin and norepinephrine. Atypical antidepressants are a new medication, and it works by affecting the balance of various neurotransmitters in the brain. Monoamine oxidase inhibitors work by an enzyme breaking down monoamine neurotransmitters. This article is by Mendel. Having established what antidepressants are, it is important to consider what type of antidepressant medication is the most commonly prescribed. The most commonly prescribed antidepressant medication is selective serotonin reuptake inhibitors. This article is by mayoclinic.org. SSRIs are the most common antidepressants because they treat low depression and they have low side effects. The main side effects of SSRIs are vomiting and problems such as not having the energy to have sexual intercourse or to do daily things in life. SSRIs cannot be combined with anti-inflammatory medication due to internal bleeding. Stopping treatment with SSRIs can cause withdrawal symptoms such as nausea, dizziness, and having no energy. While SSRIs are the most prescribed antidepressants, it is important to consider the potential side effects and long-term side effects of these medications. Should people take antidepressants for long-term, and what are the side effects? This article is by verywellmind.com. Weight gain is one of the long-term effects of taking antidepressants by 65%. Antidepressants affect blood sugar regulation, including getting diabetes. Antidepressants such as SSRIs have research proving that it worsens blood sugar regulation in people with diabetes. Some possible side effects of antidepressant can cause suicidal thoughts and risks to increase. It mainly affects children, teenagers, and young adults until the age of 25. Another side effect is antidepressant discontinuation syndrome, which happens when people just stop taking the medication. Some symptoms are insomnia, anxiety, and sensory issues. And this article is myclevelandclinic.org. Considering the potential side effects and long-term effects of taking antidepressants, it is important to weigh the benefits and risks of these medications before making a long-term decision. The first main point is explaining what are antidepressants. The second point is explaining the most commonly prescribed antidepressant medication. Lastly, the third point is how antidepressants affect the body long-term and possible side effects. While antidepressants can be an effective treatment option for those with depression, it is important to understand the risks and side effects of taking antidepressants, especially long-term side effects. Did you know that while taking antidepressants can be effective in treating depression, and they can also have unexpected side effects? So the works cited page is Should You Take Antidepressants Long Term? By verywellmind.com. What are antidepressants? By newsmedical.net. And lastly, the last article that I used. Oh wait, sorry. There's 2 more articles that I used actually. Okay, so the third one is myclevelandclinic.org. And lastly, it's mayoclinic.org. Thank you for listening.